Creating a universal vision which defines health status as the fundamental goal is essential. Using this vision, it's then possible to craft a plan forward, linking payment model reforms to drive delivery system definition and integration. Accountability for the health of a population would be local or regional, as well as a national priority. Let's look at a potential model for these elements as the basis for cross-sector collaboration and collective impact. This diagram from the Healthy People and Healthy Communities report, A Systematic Approach to Health Improvement, reflects that health improvement in the U.S. could be facilitated if the traditional public health, which is based on the Evans and Stoddard field model, as shown in the large blue rectangular section in the middle of the diagram, were integrated into a national population or public health system. This new model would include clearly defined national goals and objectives and would have as its primary focus the health status of populations. This model is extremely flexible. It can be easily applied at the national level as well as at the local or community level. Local hospitals and health systems, along with other relevant stakeholders, could be organized around this framework for systematic health improvement into a population health management model that might look something like this. This is what I refer to as a community-oriented public health system. It's based on the model Stephen Shortell and colleagues developed to describe a population health approach. Note the community is clearly defined and showed to have shared responsibilities as reflected in the large oval at the bottom of the graphic. The relevant stakeholders, or sectors, whose efforts are collectively needed to reduce the burden of illness are shown in the boxes just above the community. Note the medical care sector is but one of those boxes. Each box, in turn, contributes expertise into what are referred to as community health building assets, shown by the long horizontal box in the center. By creating a common vision around community health, each stakeholder contributes or brings their subject matter expertise to addressing identified community needs. Think of each one of those stakeholders as one of the pieces of the puzzle we discussed earlier. Payment model innovation is needed to ignite the development of such an organizational model and also sustain its form and functions over time. But how might one align and coordinate resources, allocation of identified community health building assets, and meaningfully engage stakeholders who may not have traditionally viewed their role as linked to improving health or well-being, like jobs and housing, or may not have worked together in the past and in fact may well be competitors? Breaking the community-oriented public health system down into its functional parts as represented here illustrates where cross-sector collaboration is needed to drive collective impact. The funding model provides the spark and fuel, but the system requires a new means of managing. Population health is not possible in a siloed model. Cross-sector collaboration is fundamental to identifying and interpreting the needs of the community, aligning services and service providers, allocating resources efficiently and effectively, and assuring mutual accountability for the desired outcomes. As the funding and payment models merge into a true population health payment model, and the organization and delivery models blend into a multi-sectoral population health system, new management and leadership competencies related to cross-sector collaboration engagement, among others, as presented here, will be essential. These new collaborative organizational models will be the means by which collective goals and objectives related to population health can be achieved. Improving health in the United States to levels at or above the top performers around the world requires a fundamentally different approach to how health is defined and managed. The orientation must be around that of the entire community and reflect health status, not just illness. Determining the health of the population within the defined community will require thorough assessment to establish the current state, and also based on trends and distributions, determine the needs. This is where the population health framework, shown in this pyramid, comes into play. Knowing the needs of individuals within communities, relevant stakeholders can be aligned through cross-sector collaboration to engage in the development and implementation of strategies and tactics to meet the identified needs. Payment models are designed to align incentives across multiple stakeholders, encouraging co-management of mutually reinforcing activities designed to achieve the collective impact. In summary, there are several key takeaways from this broad overview. Payment regulation alone will not significantly reduce year-over-year growth in healthcare expenditures. Payment reform can, however, be used to influence the direction, scope, and focus of the organization and delivery of healthcare. In order to improve population health, the organization and delivery system must expand to include many more stakeholders with a collective focus on health-influencing factors such as the social determinants of health. In addition, this expanded definition of what constitutes the public health system will require a new vision, alignment, and new approaches to population health management facilitated by broad cross-sector collaborations. I appreciate your thoughtful reflection of the materials covered in this lecture, and thank you again for your kind attention.